Welcome back to All Things Plastics, where we dive deep into beauty, body transformations, and the stories behind the surgery. Today's guest is a true pioneer in the post-op world. Meet Nicole, a certified lymphedema and cosmetic surgery therapist who spent nearly 2 decades transforming the way patients heal after surgery. Born and raised outside of New York City, Nicole worked at New York Presbyterian Weill Cornell for 17 years, specializing in trauma and reconstructive plastic surgery patients. But it was her own experience with smart lipo back in 2009 that changed everything. With little post-op guidance, Nicole created her own recovery method, and her results were so impressive, her surgeon asked her to start treating his patients. And that was the beginning of an entirely new field of care. Since then, Nicole has treated thousands of patients, from celebrities and CEOs to everyday individuals recovering from liposuction, breast augments, tummy tucks, facelifts, and more. She even wrote the first ever book to post-op recovery called After the Cut, which was published in 2019. Now teaches her trademarked recovery method nationwide, certifying healthcare providers across multiple disciplines. Whether you're planning surgery or just curious about how to truly recover like a pro, this episode is for you. Let's welcome Nicole to the show.
Hi, thank you for having me. I'm so happy to be here.
Yes, and when I found you online, I was just so taken back about your background, your knowledge on plastic surgery. The first book to ever be published after the cut in 2019. It is so impressive because in this world of plastic surgery, there are not a lot of folks doing what you're doing. So it's very astonishing.
Thank you. That's such a compliment. And I think that I align a lot with your take on the industry and what you're trying to do. And so it was just a natural fit that we come and chat together.
Yes, I'm so blessed that I found you. So we'll start off with your introduction and your background. Tell us a little bit about where you're from and your background in healthcare.
Sure. So I'm a physical therapist by trade. I graduated in 2004 from Thomas Jefferson Medical School in Philadelphia.
Mm-hmm.
Right out of school, I fell in love with New York Presbyterian Hospital, Weill Cornell Medical Center in New York City. What I loved about it the most was the experience that you get there. It's hard to compare anywhere else because you're getting such involved patients. You're getting patients that come from all over the world. You're working with some of the best doctors in the world, the best team, the best physical therapists, nurses, occupational therapists, everybody. So the teams around you make you a better clinician. So my background is I started out as a physical therapist there, and one of my specialties was trauma patients, specifically those recovering from reconstructive plastic surgery. So that was my background. That's how I started as a physical therapist. And then I accidentally got into this field back in 2009.
Oh my goodness. And to touch on trauma patients in New York City, that must have been such a wild ride. And to see out of school, like, oh my gosh, I can't even imagine.
Well, it was really funny because I always was a little bit of a different kind of personality from maybe those that I was in school with. They used to joke and call me the Elle Woods of physical therapy because I would come in like
I love that.
And my glam and my eyelashes done and my full face of makeup. And I'd be like, hi, I'm your physical therapist. I'm here to get you out of bed.
I love that. That is so iconic.
Yeah. So I definitely was teased a little bit in the beginning. And so, I'm working like elbow deep with like some of the craziest stories that you'll hear, like people that were hit by buses. Accidents, bike accidents, patients that fell down elevator shafts, like just wild things that I've seen over the years. And I always tried to keep an upbeat spin to people who were going through some of the worst days of their life and some of the hardest moments of their lives, but trying to just be positive in a support system and keep their mental mind frame positive. Because when you're recovering from any surgery, the best thing that you could do is have a positive mental outlook because the body listens to the mind. So
I love that. And we definitely try to tell, patients, anyone listening, that a lot, it's not just a physical change. It definitely takes a toll on emotionally, mentally, everything, and that people are not prepared for that. So I love that you try to keep a positive mood and atmosphere.
Yes, you hit the nail on the head. It's not just a 1, 2, 3 recovery for any type of surgery. And this is definitely one of the things that I've brought over to cosmetics that people need to understand. There's a recovery process.
Yes.
It does take some time, and that you're not going to look perfect the second you come out of surgery, but that's okay. That's what it's supposed to be. So if you stay the course and you do the things that you're supposed to do, you're going to look amazing, and it's going to be one of the best decisions of your life.
Now, touching back, what led you into the world of physical therapy? Did you know while you were in school that's what you wanted to do, or did someone in your family or life, were they a physical therapist?
So I had a lot of things that influenced me. One of my influences was my mother has a twin brother who was born with cerebral palsy. So we spent our entire lives, my family and myself, volunteering and helping with those who have special needs and may have been born with developmental disabilities. So from a very young age, I was very sensitive to helping those who had physical, disabilities. And
of course.
I knew that I wanted from a young age to go into the field of medicine. I wasn't really sure what aspect. And ironically, my guidance counselor in high school, because I have a strong art background, thought that plastic surgery would be a great field for me. And I said to myself, you know what? I just don't think that I'm cut out to be a surgeon. I don't think that I'm right to do the cutting.
Yeah.
And so fast forward, I'm the one who takes the baton after the cut.
Yes.
I felt that my talents would be best utilized helping people recover from surgeries. I started volunteering at a very young age. I was a freshman in high school, and I started volunteering at physical therapy centers, working in different environments, outpatient setting, hospitals. I spent my high school career, volunteering in some prominent hospitals here in New Jersey, and I really fell in love with it. And I knew that this was what I wanted to do.
Now, during that journey, when did you decide you want to become a certified cosmetic surgery therapist?
Well, ironically, certified cosmetic surgery therapist, I started that title not that long ago.
What?
So that title was my brainchild after years of working in plastics. So I began this journey back in 2009 when I was working in reconstructive plastic surgery. I myself was very into fitness, very into working out, but I found that I was struggling, that I had this layer of fat around the center of my stomach. And to kind of get that fat down, I had to get really thin and skinny in other areas.
That stubborn belly fat.
Stubborn belly fat. And I just was like, this shouldn't be this hard. I'm working out so much. I'm really restricting my calories. I don't want to live a life like this. I want to go out on cocktails with my friends. I want to go to great restaurants in New York. I loved working out, but it shouldn't have been that hard. And that's when I consulted with one of the city's top plastic surgeons, Dr. David Schaefer. And he said to me, you are really an ideal candidate for laser smart lipo. He's like, because you don't have a lot of fat to remove. You're in shape. You have good elasticity of your skin. You're young. He's like, so I think this would be a great fit for you. And I thought so too.
I love that.
I agree. But actually, I'm going to say it was my fault in the sense that I just made assumptions about my recovery. I just took a Friday and a Monday off from work. That's all I did. And
2 days.
I basically thought in a long weekend, I'll be totally recovered, bikini ready. And the craziest part was I scheduled my surgery a week before I was going to have a huge birthday party with all of my friends coming to New York.
Oh, Nicole.
From a person who didn't want to tell anyone that they were having surgery, I came out of the surgery and I looked like one of my trauma patients. I was black and blue. I was swollen. I was, no.
Yes.
We can't. Everyone's going to know. So,
oh my gosh. So you definitely learned trial and error.
And trial and error the hard way that, when you come out of surgery, you're not going to look like bikini ready. And so long story short, I went to my parents' house in New Jersey. And my parents are like, what did you do? My God. My dad's like, this is why I'm losing my hair. It's because of you.
Oh my gosh.
So
that is hilarious.
I just at that point flipped on my physical therapy brain and was like, I have 1 week to recover. I got to figure this out.
And I'm sure that's the moment when you realize that there was a gap in post-op support for cosmetic surgery patients. Because after your lipo procedure, were you like, oh my God, YouTube, I'm sure people weren't sharing their plastic surgery journeys in 2009, or vlogs or day in the lives.
2009, it was extremely secretive. No one spoke about it.
Yeah.
No one talked about it. There was minimal information on recovery. Honestly, nothing at all. It was basically pop a few Tylenol, pop some Vicodin, have a Percocet, lay in bed, and you'll look great. And
you were in the dark. 100%
I was in the
dark.
Yes. So when I came out of it and I started to work on myself out of sheer necessity, and I started to do what would end up being my trademark method, I started to do a whole formula of different things. When I went for my 1 week post-op, the doctor literally almost passed out. He said, oh my God, you look like my patients a month out. How did you do this? And I said, well, I'm a physical therapist. I switched on my physical therapy brain and I did this, and this. And he said, that's unbelievable. I would love if you could do that on my patients. And so that was the turning point.
That was, yeah, it evolved to something bigger than what you even knew that it was going to turn into. That is amazing.
Yes. And so I said to him at that point, I said, well, I have to be honest, there is no recover after cosmetic plastic surgery. There is no physical therapy. And you know what? I really thank him to this day because he said the words to me. He said, so you be the first. He was like, go ahead, do it. And I'm like, could I? Should I?
Terrifying, but yeah, it worked.
Well, I thank him because I really had a plastic surgeon to work with me side by side to make sure that I was first doing no harm. And what I was basically doing was what we do in physical therapy. We treat the symptoms and we treat the presentation we see. So if I saw that patient was swollen, I treated the swelling. If I saw they were bruised, I treated the bruising. If I saw they had fibrosis or they had scar tissue, that's what I treated. All of those fall under the umbrella of what I do for a living. I just then brought it to cosmetics.
Yes. And what makes your recovery method different from traditional postoperative care?
So over the years when I started, there was no thoughts on postoperative care. Then over time, lymphatic massage became kind of the go-to post-op recovery.
Yes.
This is what we do. We do lymphatic massage. And I think the biggest misconception is, even to this day, people think the only thing that you need to do after cosmetic surgery is lymphatic massage and that you're done. That's not the case at all.
It is a small part of the recovery process, 100%. It's not the one and only thing. There's so many other treatment options and supplements, and I mean, the list goes on and on, but yeah, absolutely. You are 100% right.
Yes. A big thing that I do is provide education, and that was what I found the reason that I needed to publish a book on the topic, because I was getting clients coming in from all over the world that I was treating. People coming from Dubai, people coming from South America, California. I mean, all over. I've treated people from all over. And people used to say to me, Nicole, if patients don't have you, how do they recover? And I used to say, that's a really good question. I feel bad. That was the driving force for me writing the book, that I wanted people to know that if they just focus on certain things, they can even recover at home if they don't have access to a physical therapist or a post-op recovery specialist that knows what they're doing. That they can take the recovery into their own hands just with simple guidance, and that they just need the information to know that it is more than just lymphatic massage.
100%. And, starting off as I was an OR nurse, and then I was a recovery nurse first before an OR nurse. And a lot of these surgeons nowadays, patients are so uneducated on plastic surgery and the whole process. They're so focused on what's my body going to look like? What's my face going to look like? They're not thinking postoperatively. So there was high complication rates, I would say maybe 5 to 8 years ago. But now surgeons are almost mandating patients. They need to either go to a recovery home. They need to get a private duty nurse because there's too many complication rates, and it's almost making the surgeons look bad because the patients are uneducated and they're getting necrosis or dehiscence, whatever it is. So go to a recovery home, pay extra. I won't book this surgery until you have that confirmation, because the nurses there will help you with your post-op care and give you some education and some advice.
Absolutely. Because when I started this, at first, some of the surgeons were skeptical about what I was doing. They were kind of like, I don't know if we need this. And so basically the angle that I took was, number one, this is the only field where there is no physical therapy or post-op care. If you go do any other kind of surgery, who are you seeing? You're seeing recovery room nurses. You're seeing, a lot of times people do hire private duty nurses to help them immediately after. And then they're going to physical therapy or occupational therapy, or they're going to some rehab specialist after a total knee replacement. Otherwise, the surgery will not be as good. And so that is the angle that I educated doctors about, that a lot of times they do the surgery perfect. They do the surgery beautiful. And then it's some of the uneducated choices that the patient makes that makes the surgery fail. It's not their fault. It's not the doctor's fault.
Yep.
But what do we hear? I look terrible after surgery. The surgeon did a bad job.
Yes, that's all the patients have to say. I paid X amount of money and look at the wound I got. Look at the necrosis. Look at X, Y, and Z. And it's like, girl, you did this to yourself. What are you doing?
Because unfortunately, they just don't know. And then the scary thing is out there that there's a lot of misinformation now. There's a lot of information of people just trying to jump on the bandwagon and call themselves experts. I've been doing this since 2009. It took me 10 years before I felt confident to publish a book on the topic, because I wanted to make sure that I really was an expert in the field before I was putting my information out there. And I wanted to make sure everything that I put out there was safe and correct, because there's a lot of people who are jumping on this bandwagon and they don't have a license. They're not a massage therapist. They're not a nurse. They're not a doctor. They're not an occupational therapist.
My biggest thing is, because, you know, I've done my research. I found your Instagram. I've seen a couple of other profiles in Instagram. My biggest pet peeve is what I've seen is these massage therapists or lymphatic drainage therapists providing post-op care or having post-op guides. And you're not a nurse. You're not a doctor. You've never been in an OR. You don't know what it's like to care for patients firsthand. All you know is you're certified in lymphatics. And how are you giving wound care advice? How are you giving supplement? How are you giving any of this advice? And you're not even in the field. I've seen that and I'm like, holy shit, if people are really buying this from this person, they're already messing up.
Okay, so this is an excellent point. So where I've now brought things, because this was out of sheer necessity, I now have one of the premier courses across the country where I certify. That's how I became a certified cosmetic surgery therapist. I started it. We started certifying through the Norton School that I've teamed up with nurses, doctors, but we ensure that you have to be of a certain level. You have to be licensed. But the number one thing I preach in my classes, you are not to give guided care outside your scope of license. So for example, as a physical therapist, you have to know what you're allowed to do. I'm not removing drains. I'm not putting in drains. I'm not taking out stitches. That falls under nursing care.
Yes.
But at the same time, a massage therapist under their license can't give prescriptive exercises or do gait training because that doesn't fall under their license. So when I'm guiding these people who are becoming certified cosmetic surgery therapists, I'm guiding them to do within their scope of their license. Practice. Now, there are people out there that are trying to convince other clinicians that they are allowed to do things out of their scope of practice. It is extremely unsafe. It is extremely dangerous. And you know who's going to get in trouble? Not the person who's saying it's okay, the person with the license. So the nurse who's being told that they can do this, this, and this, and it's not true, that nurse is going to lose their license. So know your rights, know what your license allows, speak to your boards in your state, and make sure that no one's convincing you by doing a cash grab. Come take my course, come get certified through me, and I am going to allow you to do this, this, and this. Guess what? When your nursing board or your PT board or the OT board comes for you and you say, but this lady said I could, she can be gone.
Yes, 100%. 100%. And social media right now in this day and age, it's showcasing a lot of different fields and different areas. There's a lot of pros, a lot of cons, but people think that they don't need to have licenses anymore, don't need to have certifications, and I can do X, Y, and Z. And it's like, at the end of the day, anything in relation to medical care, just because you're behind a camera, you still need a license. You still need a certification to do anything and even give advice. Like,
absolutely. It's who are you? Just because you had a platform where you put a camera on yourself, it doesn't mean that you are legitimate to give out this advice. So people who are getting the advice and receiving the advice, you have to be very discerning and you have to really think about where the advice is coming from. And that's why I always say to people, find out what their license is, find out what their background is, find out what their training is. And just because someone's calling themselves an expert does not mean they are, or they have a flashy Instagram with a lot of followers, does not mean that they are an expert.
No, definitely. Being in the plastic surgery world for 5 years and getting my master's, 2-3 years ago now, it took me still a while. I wanted to dive into the field, learn from surgeons, learn pre-op, operating room, and PACU to really start this brand, not just to hop on as a brand new nurse or 1 year in plastics, like dive in, do an array of bedside nursing so I can have a full scope of knowledge on the subject. You know, nowadays people are not doing that.
Well, it's so funny that you say that, because one of the things that I always speak about in my courses and I speak about when I'm being interviewed is the blessing that I had working at New York Presbyterian Hospital. I became an expert in all avenues. So it was a rotating hospital. I worked in cardiopulmonary. I worked in orthopedics, neurosurgery, neurology, plastics, cardiac. I worked in general surgery. I worked in psych. I worked in women's health.
All fields. I
Please.
love it.
I did everything. I was an ICU therapist. I worked in the recovery room. I worked in PACUs. I did everything. And all of those factors together were the little pieces that I put together to make a comprehensive plan for patients for post-op cosmetic surgery. It's not just one thing. It's so many things. It's all avenues of recovery from
anatomy to physiology. From anatomy to physiology to wound care to post-op diets and nutrition. And there's so many aspects besides getting lipo BBL and having a big booty and
then
making
just doing
sure
lymphatic massage.
Yeah, it's so much more. And, you know, we're out here preaching, but you have been around the block. And I want to know, what are some common mistakes people make after cosmetic surgery that can actually slow down or hinder recovery?
Okay, so my number one thing, and this was something that I came up with a long time ago, and it's so funny because when I hear the words out there and people preach about it now, and I'm like, I can tell you the day that I came up with that back in 2010, eating a low salt diet. So at the time, I was treating a lot of models in New York, a lot of models. I was working with a lot of models. They were getting lipo. And I saw that models were way more swollen than everybody else after liposuction. And I'm like, what is going on here? And I would open the door and I'd go into their apartment and they would be like in tears. They'd be like, I ruined my career. I've ruined everything. I'm so much fatter than I was before. I'm fatter. And I'm like, what is going on? And one day I clicked in my head. I said, can you describe to me what you're eating? And they all sort of follow the same thing. They eat a lot of sushi, soups, low fat, low calorie diet, high sodium. So that is what I saw. So I'm like, oh, let's do something with this. Let's start to strip the sodium out of the diet. And it
reduce the swelling.
Wonders. Made such a big difference. Stripping the sodium down. So, you know, you could do everything right. You could have lipo, you could have a tummy tuck, you could, for a lot of the surgeries. And then if you come out eating a high sodium diet, you're going to make the results 10 times slower and look worse. And that actually leads to more fibrosis and poorer healing. So the number one thing I have patients do after surgery is strip down the salt in their diet, eat a very high protein, high vegetable, nutritious, vitamin rich diet that also helps with wound healing. And I have them minimize the salt. That's the number one thing.
Yes. That is huge. And a lot of people don't know. It blows my mind. They're like, yeah, I've been eating soup and crackers and a ginger ale. And I'm like, canned soup? They're like, yeah, what's the issue? And I'm like, girl, if you look at the back of the label on the canned soup has the highest amount of sodium. I said, you have to get fresh soups. Go to your local grocery store and, go to the little bakery.
Make it yourself. Yes.
Or make it yourself. I know it's hard after surgery, but if you prepped appropriately, that wouldn't be an issue.
That's exactly right. I have that in my book. Prep all your food before surgery.
Yes. So.
And the other thing is, it's not always their fault. There are a lot of surgeons. Do you know what they're recommending patients go and do? IV drips after surgery. What people don't realize is IV drips are they're loaded with sodium.
Yes. Yep.
So, or they're recommending protein shakes. Not all protein shakes are created equal. Some are higher in sodium. Yep. I've even had some doctors' offices recommending Gatorades and Pedialyte.
Gatorade is trash.
And it's totally filled with sodium. And Pedialyte's great. I think Pedialyte's great if you're recovering from the flu or hangover. I think
and a lot of sugar and a lot of sugar too, sodium and sugar. And then when you drink alcohol and then you're down in Pedialyte or Gatorade, and that's why you look 10 times more swollen day 2 hangover. Correct. It's like,
maybe you need that for your hangover, but you do not need that for cosmetic surgery. It works against you. Now people say, but my doctor said hydrate. Hydrate the right way. Hydrate with water.
Yes. I love that you touched on that. And you've treated thousands of patients. Can you share one of the most memorable transformations you've witnessed?
Honestly, there's one girl, she still to date, stands out in my mind. This was maybe around 2012. Mm-hmm. And I got a phone call about this girl. The surgeon's like, oh my God, Nicole, I need your help. She's beautiful, young, super in shape. But we do not know what is going on. She just blew up after surgery. She had lipo of her thighs.
Oh my God.
Blew up tremendously. I walked in the door. Each one of her legs was like this big. Black and blue. I couldn't even see her legs because they were just so black and blue. And I'm like, what is going on? One of the biggest things I do at the start of every one of my evaluations is I do a history, because you don't know where you're going till you know where you've been or where the patients come from.
Yep.
An HPP. She had, prior to surgery, celebrated having liposuction by going on a girls' trip. And they went to Puerto Rico. So she spent the entire week downing margaritas, which thins your blood.
No.
The alcohol thins your blood, and the salt around the rim, super, super, super salt, high concentration, even going into surgery, made her retain so much fluid during surgery. Because what happens is during surgery, for the blood that is lost and the fluids that is lost, the surgeon has to provide you with an IV. They have to provide IV fluids. It's part of the surgery. And the problem is when you have such a high sodium count in your body going into surgery, the body doesn't release the fluid, so it just held on to it.
Yes.
And then with the alcohol, it thinned the blood. She got black and blues anywhere, and then her skin just expanded. Her legs just expanded.
She had so much fluid retention.
Yes. And I will never forget, after one session with me, she said that she peed and peed and peed all night long. The next day I came back to see her, she lost 8 pounds of fluid in one night.
That's a lot.
Pounds.
If you guys don't know, if you're retaining that 8 pounds of fluid in your system, your blood pressure goes up. Your circulatory system is working 10 times harder. That can cause a lot of complications, and it can, your kidneys, it makes them work harder. That is
definitely for lower extremity lipo. It also puts you at higher risk for a blood clot because, of the compression and the decreased mobility. She could barely walk.
Yes.
So all of these things definitely, it was one of the most crazy moments, but at the same time, one of my biggest transformations. Her recovery stays in my mind that every day my mind was just blown at how quickly great she was recovering.
Man. Now, what surgeries do you treat most frequently, and do different procedures require different recovery strategies?
Absolutely. So I treat everything from liposuction to tummy tuck to breast implant augmentation to facelifts, rhinoplasty. You name it, I've treated it. Now, yes, every surgery has a different technique to it. For example, liposuction. I start treating liposuction patients around 48 hours after surgery. Breast augmentation. I don't touch them for 1 week. I don't touch the breasts for 1 week. If they just because they need to stay in their post-op bra, and I have certain parameters that I don't have them do. Like I don't have them lift their arm above 90 degrees because I don't want the implant to displace out. Now, some surgeons will say, we don't agree with that because what about frozen shoulder? As a physical therapist, I'm here to say the likeliness of a young, in shape person. Maybe
20-year-old is not
20-year-old, they're not getting a frozen shoulder. Maybe if it's a breast augmentation done on a woman in menopause who has a history of something like that, maybe she's going to be at risk. And so maybe we'll modify that a little. But for your average breast augmentation, they're not going to get frozen shoulder. But repeated overhead movement that first week could put the patient at risk for the implant displacing out. So yes, I modify and I tailor my recommendations to the patient that I see and to the patient, each individual patient. Not all surgeries are created equal.
No. And are there certain procedures that require more intensive aftercare than others? Like, let's say, a tummy tuck rather than a breast aug or so forth?
Well, I get asked this question a lot. The most intensive recoveries are the patients who have multiple procedures. Multiple procedures are trickier to recover than one procedure. And when someone's calling me to set up a consultation and they say to me, I just had a little spot lipo done right in my upper abdomen. That patient is going to be a totally different first session than a patient who had tummy tuck, lipo, breast aug, BBL.
Yes.
That's a totally different patient than the patient that just had a little spot lipo. Yes, there's certain surgeries that are a little more involved. Tummy tucks, not all tummy tucks are created equal. Do you have a tummy tuck that's just skin tightening? Or do you have a tummy tuck with lipo? Or do you have a tummy tuck with lipo, skin tightening, and maybe diastasis recti repair, muscle repair? So not all the same surgeries are created equal.
Definitely. Did you get drains? Did you not get drains? It's so crazy that there's so much knowledge and, people need to be really active and do their research and not, like you said, there's different types of breast augs, under the muscle, over the muscle, different incisions, same with tummy tuck, same with lipo. Everything is different. Not one procedure is created equal.
Correct. And you can have two patients, and I say this all the time, you can have two patients who have the exact same procedure and they are not going to recover the same. So that's why when people come to me and say, in exactly how many days will I look like this? In exactly how many days look like that? And my response is, if someone can tell you that, they don't know what they're doing.
back to social media playing a part. Everyone is doing their research on YouTube. And I saw this girl, she got lipo BBL and she did X, Y, and Z, and she was back to work and driving by day 7. Okay, this girl is 20, you are 40. This girl has not had children, you have. You have a medical history, she doesn't. There's so many factors, but people watch other people's surgery journeys online and assume it's going to be the same for them. And I'm like, how many times can I scream into the screen that it is not going to be the same?
Exactly. It's not always the same. And listen, you have to take social media with a grain of salt because a lot of times people put out there what they want to put out there. Maybe there were complications and they decided in their mind that they were going to post about having a great recovery or they were going to post about having a flawless recovery. And maybe they exclude those points of the bumps and the trials and tribulations that they had along the way. So you can't always believe what you see.
No, definitely not. And a question that you probably get a lot, how soon after surgery should patients ideally begin post-op therapy?
Well, it depends. It depends on your surgery. It depends on the procedure you have. Post-op recovery strategies begin the day of surgery. The day of surgery. So a lot of what I do is I consult with patients before surgery and I let them know exactly what they're going to be doing day to day. And then when I will come into it. So for example, maybe I'm not going to start working with a patient till day 3, but day 1 through 3, they certainly have homework. And their homework is going to be getting out of bed, walking to the bathroom, certain exercises to prevent blood clot. If a patient spent a lot of time down, a lot of time under general anesthesia, I even have lung exercises that I want them to do. So post-op recovery begins the day of surgery. Not even the day after surgery, the day of surgery. You got to go home and you know, people think just pull up the covers, get out of bed in a week and they're recovered.
No. And you know, what really opened my eyes to this was working as a recovery nurse, a private duty recovery nurse in Beverly Hills. You know, patients would literally fight me and get mad at me because we had strict parameters. Hey, you just rolled in. It's an hour, 2 hours post surgery. You're not groggy anymore. Let's get up. Let's void. Let's move around. Let's check your vitals. Okay, we got to get a spirometer. They're like, this is in a hospital. I booked a nice recovery hotel in Beverly Hills just to lay down and relax. I'm supposed to be relaxing after surgery. And it was such a big reality check to them. Like, no. We're still walking every 2 hours. We're still doing everything that you would do after even a general surgery. Like, you're not just going to lay on your ass all day. There's no way.
Because of the point you just made, that was a phenomenal point you just made. We hold them to the same standards of people recovering from a general surgery. People do not think of plastic surgery as real surgery. And unfortunately, because you can maybe like buy your procedure with a Groupon, it doesn't, you know what I'm saying? Like I say this all the time. Imagine buying like an appendectomy with a Groupon, die. Like I was dead. Like, no, you can't, you know?
No, they think it's like a luxury. It's plastic surgery.
Got my liver transplant on Living Social. You can't. No, it doesn't work that way. So they don't think of it as real surgery.
No, and I had, you know, we take care of a lot of people with money and celebrities, and it's like they even were like, no, I'm paying you so I can relax, and you can bring me a collagen smoothie from Erewhon, and I'm like, no, you're paying us to make sure you have a safe and effective surgery and recovery. And, you know, I got my head chewed off a couple times, but I was like, look, as long as you're under my care, I'm your nurse. We don't have any complications. You can hate me all you want, but as long as you're safe out that door, goodbye.
Preach. Thank you, girl. And I'm going to tell you this, you know, I have given this speech many times. I've treated very influential celebrity, treated very influential people, and I don't take crap. And the reason is because when patients come out of my recovery, it's my reputation. How they look and how they heal is my reputation. And guess what? And this is what I've told patients. I make the same amount of money if I'm treating you or if I'm treating Joe Schmo off the street. I don't change my prices because I have a standard of ethics that I follow HIPAA. You know, there's certain guidelines. I took an oath as a physical therapist. You know, my prices don't change because I think that you maybe have more money or maybe like you're more of a celebrity. That is what I do is what I do. So your 1 hour or your 2 hours is the same 2 hours over here. And I'm not going to have someone fighting me and arguing with me because I am here to give the best post-op care. So if you're sitting there after a facelift, because I've literally had this, whipping cigarettes right out of your surgery and drinking your drink, and I'm like, if you continue to choose to go down this path, I'm not your therapist. And the reason
not going to care for you.
Surgery is going to fail, and I don't want my name attached to it. and it's
Nope.
going to fail.
Yeah. And do you think that there's a misconception about how celebrities recover from surgery compared to the average patient? I think there is. And I think
Yeah.
when surgeons are dealing with celebrities, and I hate to say this, they give them more leeway. They give them leeway. I'll use the term leeway with celebrities than the average patient. I feel like there's so much more strict on an average patient rather than a celebrity, and I'm like, wait, what are you doing? Like, that's a red flag to me.
If they don't want to walk. It's
Yes.
fine if they don't want to do this. They
Don't
really
push
want to wear their
them.
garment. Yeah, don't push them. And my whole thing is, I don't care who you are. You're going to get
Yes.
treated the same, because you're lucky that I'm treating you the same. Because I think
Yes.
the worst thing to do is give someone the answer that they want to hear. I spent a good portion of my career working. We had at New York Presbyterian Hospital, we had a VIP floor. And this was patients coming in from all over the world, kings, queens. And as one of the treating therapists up there working with very VIP patients, it was my job to make sure that I was treating them with the best of my knowledge and my capability and my recovery skills. Because if I let their influence change my mind and my guidance on their recovery, I was not doing them any favors. So it's when I really learned how to be like, hey, listen, your choices are your choices, but my answer is not going to change. This is what you have to do to recover. And if you don't want to follow that, that is okay. That is your choice. But my answer is not going to change, and you're not going to hear from my mouth. You know what? Crush that pepperoni pizza and chase it with those fries, and you're going to look amazing. Like, nope. My answer is not going to change. That's not a good idea.
And, not even celebrities. Another thing is like these recovery homes. I've interviewed a handful of girls now who've gone surgery in Miami or Turkey or Colombia, whatever it is. These surgery homes, they're the quickest cash grab, because it's like, okay, you just want to sleep, sweetie. I'll bring you your 3 meals a day and I'll transport you to your post-op appointment, but go ahead and rest. It's okay. You're paying a lot of money to be here. Just rest. And I'm like, what the hell?
No. And that's why I always tell people, because I have had a lot of people call me to consult about a lot of different things. I had people call me and consult about starting recovery houses. And my mind is blown to hear that people who are starting these recovery houses have no medical background.
No, none.
They have no license. One girl was going to just open. She had a beautiful mansion in a suburb of New York, beautiful mansion that she just wanted to do something with it. And then she was going to just open the doors next week and start a recovery house. And I'm like, you didn't get a license? You haven't followed any accreditation? You don't have a doctor on staff? You don't have a nurse on staff? Oh my God. And so it made me realize and opened my eye that just anyone can open the doors. But my thing is, just wait. I don't think that we've really started cracking down, that they really haven't started cracking down. Like, I think that's coming down the pike. Right now, how we call it, it's the Wild West.
It is.
It's the Wild, Wild West in recovery. There's just people running recovery houses.
It is.
Unlicensed. There's people who are unlicensed, being experts in the field. And wait till things start going wrong. They're going to start cracking down. People are going to start going to jail.
More lawsuits.
And then, yes, more lawsuits. And then people are going to think twice before they start deciding that they want to do this illegally.
And my boss always said, when I was a recovery nurse and aftercare nurse, my boss always said, this is a very gray area. So I rather do more, have the proper charting in place, have post-operative instructions, have just things like run it like a hospital, because you never know the day when the government comes down or you get a sue, because we're getting lawsuits if we're working with high clientele people. They love to sue. Run it more like a hospital, be stricter, because we're in a very gray area, and we're still in that gray area. But I think more people, like you said, things are coming down the pipeline and more people are catching on. For sure.
So my certification is a 6-day intensive. It starts at 8 a.m. People don't leave till 6, 7 at night. And there are 2 practical exams, 2 physical exams, and 2 written exams. And the reason these people are held to these standards, listen, I could have made a lot more money if I opened this up to everybody. I could have made a lot more money if I made this course shorter. People have asked me, can we do this online? The answer is always no. Because
I love that.
I preach exactly what you say. When I am certifying someone to become a certified cosmetic surgery therapist, I am preaching to them. They have to run their sessions like they are a clinician, a medical personnel in a hospital, or that's their training. They have to have the right documentation. They have to have the right insurances. They have to cover every aspect of their treatment to make sure that they are first doing no harm. So
CYA, cover your ass.
Yep. I deep dive into the do's and don'ts, what you need to know before you put your hands on someone. And it's
100%.
imperative that they need to know that. And not everyone passes the course because that's my responsibility for releasing them into the world.
I love that. And touching on your certification, I never think we got into this. What inspired you to launch a national certification program for other healthcare providers?
So I was doing my thing, just treating on my own for a very long time. And then I was inspired to write the book. And I wrote the book. It came out. It launched. COVID hit.
Ooh.
Boom. Yeah. So plastic surgery shut down. Everything shut down.
Yep.
But then things started happening. There was the whole explosion after, because people were doing a lot of FaceTime, a lot of things like that. Then people were using COVID and the masks as an opportunity to get work done. What COVID did for me was it moved a lot of my consultations to Zoom and online. People were reaching out to me after my book came out through Instagram. And a lot of the people that were reaching out to me were nurses, physical therapists, occupational therapists, doctors. I want to do what you're doing. How do I learn how to do it? How do I do this? How do I do this safely? They're like, I don't have the 10, 15 years experience that you have. I don't have that background, but I want to start getting into it, but I want to start getting into it safely. And I just was getting inundated with messages, phone calls, and especially after I did the Skinny Confidential podcast. Therapists from all over the United States were reaching out to me saying, how do I do this? And so it just really inspired me that I felt the need to help people help others because it's a multi-billion-dollar industry. What am I gaining by keeping this method to myself? I'm not treating everybody. And
you can if you wanted to. You're one person. You're one person.
I'm one person. And I just felt like I saw the writing on the wall that there were so many people doing the cash grab out there that were then calling themselves experts. And they had no knowledge and they were no background.
None.
And they just saw the hole in the market and they wanted to. And I said, oh God, no, this can't happen to people. Let them get the information about the right way to help people recover and the right techniques and first do no harm. And so, it took me over a year to write the course guidelines for the course. It took me a year to put together a binder this thick. But
it's a lengthy process, definitely.
Yeah. But when people finish my class, I really feel that they have given me the feedback that they feel prepared and that they feel that they could treat patients and safely and confidently. And that was the goal.
Yeah. And that's such a rewarding part. Anyone in healthcare, we're here to serve others. That's what we enjoy doing. And you're honestly making way and helping others help others. I think that's the biggest reward.
Yes, that's what I hope to do for people is help them help others safely.
Let's talk a little bit more. I'm sure we could talk forever about your book, which is called After the Cut, which you launched in 2019, right before COVID. And, what can you expect readers to learn? I know you talk a lot on post-op care, and I'm sure there's so much more knowledge, but what are the key takeaways that you hope for people to take away from reading your book After the Cut?
So one of the biggest things I hope people take away is I chose the title After the Cut, How to Prepare for and Recover from Cosmetic Plastic Surgery. That one line, how to prepare for. People do not realize that the recovery process actually begins before surgery. You have to go into surgery prepped. You have to have the right supplies. You have to have the right environment set up. You have to have your food prepped. In the last few years, have been treating a lot of mommy makeovers, a lot.
Yep.
What people don't realize is they have to have proper childcare. They have to get the help. Yeah. Like if you have a 9-month-old baby that you're picking up and lifting every day, or this 1-year-old or 2-year-old and they're 20 pounds, 22, you can't be doing that right after a major tummy tuck, especially if like diastasis recti repair. So you have to have all the things in place before going into surgery. And this will give you the best outcome for recovery.
Even being mentally prepared for surgery as well. There's so many mental challenges after cosmetic surgery. Did I do the right thing? What did I do? And if you're in a negative headspace prior to surgery and you think that changing your looks or changing your body is going to magically make everything better, you are completely wrong.
So in my book, one of the things that I do is I teach patients, I guide them through a checklist. Why are you choosing surgery? Is surgery right for you?
Yes.
Are you making the right choices? Do you know why you're getting into it? So you hit the nail on the head. It's knowing if surgery is the right choice for you. And then to that point you made, that headspace that you go into right immediately before surgery, I actually guide patients in my book, and I source this from therapists and psychologists who specialize this. This is not my specialty, but I sourced it from them. The techniques, the relaxation and meditation techniques that you could do going into surgery. I even tell people, watch something funny on your phone. You go into surgery calm, relaxed, happy, even laughing, makes your heart rate better, respiratory rate, a blood pressure. They have found going into surgery in a positive, happy, calm, non-anxiety state, your vitals will even be better. So
100%.
Your recovery will be immediately better. Just having your point that you made, a better mental headspace going into surgery. Exactly.
I love that. And why do you think that there's such a gap in literature around cosmetic surgery recovery? Because it was so taboo back in the day that, oh, I'm not going to dare touch this topic.
Very taboo. I actually felt a very interesting feeling when I first got into this. There was almost like some prejudice in the medical field, like, ugh, you're helping people recover from a boob job. And I'm like, just because it's elective, just because it's cosmetic, and just because people are trying to make them improve their lives, why are we being prejudiced against them for trying to make, not everybody's an airhead bimbo trying to look like a Barbie doll. And most of my patients over the years are your average person. They really are. They're your average person like me and you and everybody else that just want to be the best versions of ourselves.
While I was in nursing school and everything, like you assume based off social media and celebrities, oh, people who only get plastic surgery are either celebrities or they're crazy and they're bimbos and they're trying to be something they're not and they're getting these outrageous procedures. And then once I actually started working in the field, I'm like, holy shit. This is a lawyer. This is a mom of 4. This is a janitor. This is, you know, people that you never think are getting plastic surgery and they're your average everyday people and they're not coming out looking like Barbie dolls. You know, it was a mom of 4 who just had kids and she's trying to get back to her old self. Or it's an older lady who just wants a subtle facelift because, you know, she spent years caring for her husband. Her husband just passed away and she wants some change. It was very eye-opening to me. And I'm like, we have to spread the word on this because
the majority of people are just your average person trying to do better. And listen, the oath I took when I became a physical therapist, and this is what people need to remember, you're treating without prejudice, you're treating without judgment. I mean, the people that I've treated over the years in the hospital, am I judging the person that smoked 3 packs a day and then had to have half their lung resected out, and then I'm helping that person recover after surgery, holding their chest tubes, a fluid draining out of their... No, I'm not. And I'm not, because they don't need that. They don't need someone wagging their finger like, you did this yourself. Nobody needs that. You're encountering people some days on the worst day of their life. Like that moment that they're recovering after surgery is some of the worst days of their lives. And they don't need us judging them. And so I've treated even criminals. I've literally treated people in handcuffs before. I mean, wild. I've had wild experiences of people.
I had to work. Let me tell you, I went from plastic surgery to a prison because plastic surgery couldn't shut down. We couldn't operate, right? So I had to pick up a travel assignment and I wasn't about to go to the hospital. So I picked up a travel assignment for 9 months at a prison and I was doing COVID crisis team in a prison. And I was like, holy shit, 2 opposite ends of the world right now.
Absolutely. Preach, girl. Like that's it. Seriously, right? Like you're in the thick of it. And people don't realize that. But we treat without prejudice. Why in cosmetics? So I really felt it when I started. I felt the judgment. People were like, what are you doing? Like you're helping people recover from plastic surgery? Like, ugh. And they almost were then judging me as a clinician.
Yes.
And I'm like, listen, this is between me and God. I have done God's work for many, many years. When I worked in the hospital and most of my bread and butter, I was helping people recover from cancer, helping people recover from trauma. I worked with children for many years. I mean, children literally hit by cars, crazy things.
They hear plastic surgery and they assume that your knowledge or expertise is not up to par just because it is cosmetic or elective surgery. I 100% resonate with you.
Yeah, that they just think that, and it's unfair. And it's like this population needs good post-op care and guidance as well. Why are we excluding them from everything else? And it just made no sense to me. So,
but I do think as the years go on, I think we're really making good headway, especially with the use of social media and educators and platforms like both of ours. I think we're getting there. It's going to still take a couple years, maybe another decade, but slowly but surely we're making progress.
Absolutely. I agree with you. And it's people with great backgrounds like yourself, like just hearing your resume and hearing where you've come from and hearing your experience, like You are what every post-op recovery nurse should be. You know what I mean? Like
Yes.
you have experience in all different settings. You listen to your patients and you understand what they need. And it's about the goal of getting them to recover as best as they can. It's not about just making them like cute and feel happy and, just doing that money grab. Because I always found that if you bring your best self and you bring ethics to this field and you give the best post-op care, you're going to rise above everybody else who's just trying to like be in it and for the fluff.
The cash grab only will last you a little bit. People will start to catch on to the bullshit.
Yes.
Now, what's your number one piece of advice for someone preparing for plastic surgery? If you could tell one person one thing.
One thing going into surgery. Read my book. No, I'm kidding.
I know.
I'm kidding. The one thing going into surgery, they need to allot a certain amount of time for recovery. The biggest mistake that I see people do is, I'm going to return back to work in 3 days. I'm going to return back to work in 4 days. Listen, you're about to spend a big chunk of money on the surgery.
Mm-hmm.
If you don't allow the time and the effort that is needed for the recovery, it's going to fail. So don't do it.
Yep.
Like,
you waste your time and your money.
Don't waste your time and your money. And potentially put yourself in a worse spot than you were before, looking worse than you did before. Because if you recover terribly, you can look worse than you did before. So I tell them, if you don't understand that this is a recovery process and you don't understand that there's a little bit of time and effort and a little bit of extra money and a little bit of extra time that you need to put into it, and when I say a little bit of extra money, like even buying a compression garment, getting some arnica, some people only allow the money for the surgery, and that's the last time they have. That's the last time you have.
That's another thing. You have to have a separate budget for any post-op treatments, supplies, supplements, and care if something goes wrong. People are just paying for the surgery, and I try to preach this so much. You have to include even a pre- and post-op budget for the surgery. And if you don't have that budget right now, guess what? Let's push back the surgery a couple months until you have that budget.
100%. And not just the budget, the time. Like, if you're a teacher and you're trying to do this on your spring break, you can't just do it on your spring break. It's not going to work. It's not enough time. You know what? Take the summer. Yes, because there are challenges to recovering in the summertime.
Mm-hmm.
With everything, there's something. In the summertime, maybe where you live, it's hotter, it's more humid. Yeah. You know what? Maybe you want it to be bikini ready for the summer. You know what? One week
worth it.
Isn't going to do it. So why don't you just take that time? That summer will be a bust, and then you're going to look perfect and amazing for the following summer or the next break.
Rushing the process will not lead to perfection any quicker.
So that's my number one advice for people going into it, that they need to understand they have the time and the money and the effort that's put into the recovery process.
Yes. Now, where can our listeners find you, your book, or even sign up for your training?
So everything is on my Instagram at After the Cut Book. You can find my link to buying my book on Amazon. You can find the link to signing up for my course. You can also contact me if you need to schedule. I do a lot of Zoom consultations with people. I've actually had the opportunity to consult with people all over the world. Now, I let this be known. It's not a physical therapy evaluation treatment. It's just a general consultation. It's just a consultation giving advice about plastic surgery recovery and prep and recovery. Very much similar to what we're talking about today.
Yes.
So people reach out to me on Instagram all the time, and it's been very cool. It's been very cool for me. I've been able to talk to people in Portugal, Spain, and I don't even have to be in the same room as them. So it's been amazing. So people can speak to me from LA, everywhere, and I can give them guidance on prep and recovery and what they need to do, and things like seeking out a specialist, a nurse that can help them through recovery. So I'll help them, guide them to find the people that they need to put in place for their recovery.
I love that. Beautiful. Well, you are a golden gem in this whole plastic surgery world. There are very, very few, and I say that with confidence because I've done my research. There are very few people doing what you're doing, and I hope you continue to do it. I know you will. What we're doing it's definitely changing lives and going to continue to change lives. And Nicole, everything that you're doing and what you are going to do, I'm so excited to see what the future holds. And I just want to say thank you so much for coming on the All Things Plastics podcast. I was so excited. We've been planning this back and forth because you have been so busy with your educational courses, but allowing the time to come on and spread your knowledge and insight, it's honestly, I want to thank you. I couldn't thank you enough, but thank you.
And it's very much reciprocated. It's amazing to talk to somebody who's so knowledgeable. And I really do feel what is very rare, like the ethical aspect of what you're doing and what you're preaching. And it's beautiful because you're the person, you're the type of people that we need in this field. Like
Thank
these are the
you.
type of people that we need out there. And, you deserve the microphone in front of you because a lot of people pull a microphone in front of them and they don't deserve to be out there talking. And I'm like, take it away.
Yeah.
But when people like you are out there and preaching, you're preaching all the things that are not just plastic, but all the things that are right in plastic. So I appreciate that. So
thank you.
Appreciate what you're doing as well.
Thank you. And everyone listening, if you guys want to go to Nicole's page, we will definitely be collabing and tagging Nicole so you can go to her page, look at her book, look at her educational courses, and feel free to ask her any questions in regards to plastic surgery and post-op care. But once again, Nicole, you are amazing, and thank you so much for coming on the podcast. And for those listening, we will be talking to you guys next week, and talk to you later. Bye.
Bye.